Hello, Miss Petunia. It's CNA Lily. How are you doing today?
There are so many nursing homes, so many assisted livings, even private home health. They need someone to care for them, and there's such a shortage. I know Dr. Cavato, and she was telling me about a grant that Lindbergh was going to get. And the grant was to start a program for CNA students.
My mom before has been in the hospital and has been taken care of by all the professionals. I was like, okay, I want to be able to give this care to someone else and cater to someone else's family to make sure that they can get the same care that they gave to my mom.
I was 11 months old and I had a liver transplant, so I've kind of had my fair share of the hospital. I've seen some really great nurses and also some not so great ones. I just want to be a changing part in the medical field.
They have learned all the skills that are required by the state of Missouri to pass their certification. So we kind of do a demonstration, then they practice with their teammate, their partner, and then they come in and perform the skills. But they have learned all the basic skills that they need for next year, which is part 2 of our class. They'll go into the clinical settings, and we have partnerships with Friendship Village and Bethesda, and they'll go in and put these skills in action.
It's definitely helped me understand communication in a different way that I've never done before, understanding where the patient is and meeting them where they are, even though they're not real patients.
They've been learning that, how to treat people, just how to talk to them, how to care for them, what their likes are, what their dislikes are, so that when they get out there with real people, they'll already have this sensitivity and this caring nature about them. I can teach them how to put a patient on their side. I can teach them, how to care for somebody, how to feed them. But if they're not doing it with compassion and just empathy for their fellow man, that person feels like they're a burden, and we don't want that. These skills that they're developing, they'll be able to carry with them to nursing school or to any of these schools that they're going to and really have a jump up, I feel, because they've been doing it.
It just makes me really excited for the future, and I already feel so ahead, even talking to my mom who's a nurse and my sister who's in med school, just seeing not ahead of other people, but how much potential I have even at this age, and how I can always grow from here.
I can't wait to see what these kids are going to do, because I think we've got a bunch of future doctors in here. We've got radiologists, we've got maybe social workers, or maybe somebody goes, you know what, medicine's just not for me, and that's okay. But they'll know now, and they'll have this foundation, but they'll always have that to fall back on.